I'd like to thank Professor Stankovic and members of the EBC committee for inviting me to present our ABC classification of left mainstem disease. My name is MAMAS. I'm Professor of Cardiology based at Keele University in the United Kingdom, and I'm also presenting on behalf of Professor Joseph Ludwig from Germany. So the Medina classification represents the current gold standard for classifications of bifurcations, both left main and non-left main. And it consists of three numbers, characterised by the presence of disease in the main branch proximal vessel, the first number, the main branch distal vessel, the second number, and the side branch, the third number. So you can get 7 different types in the left main, depending on the presence of disease in the proximal, distal, and side branch. However, Medina has a number of limitations, particularly in the left mainstem disease. So first and foremost, it does not provide information around sizing of the vessels, which is crucial in defining strategy. As you can see in the 2 examples below that may have very similar Medina classifications, the top left figure shows a very dominant circumflex, whereas on the right it shows a very large dominant LAD. And the treatment strategy would be very different in these 2 examples. Medina also does not take into account dominance of the LAD and circumflex. So for example, a 110 lesion as defined by Medina would suggest disease in the proximal main vessel, in the distal main vessel with no disease in the side branch. But of course it very much depends on what is considered to be the main vessel. So generally we would consider the LAD to be the main vessel. But if you have a very large dominant circumflex and a very small non-dominant LAD, the circumflex becomes the main vessel, and so immediately you can see the confusion. And thirdly, the third problem is around trifurcations. So from the Excel randomized control trial, we know that 10% of distal bifurcations are in fact trifurcations, and around 1% are quadrifications. And therefore, describing trifurcations using Medina is challenging, and describing quadrifications is almost impossible. That is why Dr. Joseph Ludwig and myself have developed the ABC classification of coronary artery disease for left main. So each vessel is named with a certain letter. So the left main is termed A, the LAD B, the circumflex C, and intermediate D. Sizing of the vessel is characterised by either a capital letter if the size is greater than 3.5 millimeters, or a small letter if the size is less than 3.5 millimeters. And finally, the letter is present if the disease is significant, i.e. there's a 70% reduction in lumen diameter, or positive FFR or CT FFR, or based on anatomical considerations such as IVUS and OCT. So in the top left example, it's capital A, capital B, capital C, because each branch is greater than 3.5 millimeters and there is significant disease in the left main, LAD, and left circumflex. In the middle example, it's capital A, small b, capital C, because the left main is significant and it's greater than 3.5, therefore it is a capital A. The LAD is significant, but it's smaller than 3.5, therefore it's a small b, and the circumflex is significant, therefore it is a capital C. And on the far right, it's capital B, capital C, because the disease in the left main is not significant. The disease in the LAD is significant, and the vessel is greater than 3.5 millimeters, therefore it's capital B, and small c in the left circumflex. And these are some examples. So in this example, you have significant disease in the left main, so that's capital A small LAD, small b, and a capital C because the circumflex is greater than 3.5 millimeters. In this trifurcation, you have significant disease in the left main, so that's capital A, significant disease in a large LAD, so that's capital B, and both the circumflex and the intermediate are smaller than 3.5, so they become small c, small d. In this example, IVUS did not show the left main or the LAD to be significant, and therefore the only significant lesion here is in the circumflex, and this is a large vessel, greater than 3.5 millimeters, therefore it is capital C. And this is another example, capital A, small b, small c. So in summary, the ABC classification provides advantages over Medina for left main stem disease in that it provides sizing information, removes confusion regarding the side branch in case of dominant left circumflex and small LAD. It enables classification of Trifurcations and Quadrifications, and it's easy to remember. I thank you.